Hey, I'm Jarrett Mitchell,
And I'm Steven Schrader.
and we're going to be doing our video on substance abuse in nursing. So, substance abuse is the use of any controlled substance, and such as narcotics, barbiturates, any kind of sedatives. And this has become a real problem in nursing because of the fact that it's become so easily accessible to so many people. One of the things that most nurses will tell you is, they're thick, they're thick as mud, pretty much. So, one nurse may try to cover for somebody and not show that they need to have help. So really, the main thing you want to realize is that early recognition and involvement is paramount. The thing about early recognition is the earlier you catch it, the earlier you can treat it, the earlier you can prevent somebody from getting hurt by these things. And involvement, don't just stand by and let it watch, and let it
Take place.
take place. Yeah, thank you. Most facilities are going to offer substance abuse counseling free of charge to their employees. This has come about since the rise in substance abuse and work-related complications with it. A lot of places offer these services, but not a lot of people know about them, and they think, well, I'm going to get charged for them, or I'm going to get fired if I go to see these people, which is not the case. So you need to make sure that if you know somebody that's going through that and they have that service available to them, that they take advantage of that, because it could save their life. Next thing is, nurses have a greater exposure to these substances than most other occupations. Nurses deal with so many different types of medications, from sedatives to narcotics, barbiturates, and the fact that they actually make a schedule the drugs, and a lot of these are very, very potent, very addictive drugs. So, like we said earlier, hello Chico, early recognition and involvement is paramount. The longer the occurrence of the use, the harder the ability to admit there's a problem. The longer these things go on, and they become almost second nature to somebody, and if they haven't got caught, they think, oh well, I can get away with it this time, I got away with it last time, and it just becomes a lot more challenging procedure for them to actually get the drugs. And this doesn't only happen in the workplace. It happens, they get them from friends or family members without them knowing, or they go to all these different doctors. Nurses more than anybody probably know how to work the system. So it's really important to know the warning signs and how all these things come about. Once identified, doing nothing is just as bad as the problem the individual has. You can't just sit around and ignore the problem. That's like the ostrich sticking his head in the mud to not be afraid of something. So ignorance is not a solution to the problem. And this leads to a term called enabling. You're enabling that person by not confronting them and not showing them that there is a problem. The first step to admitting to treatment and resolution of the problem is admitting that there is a problem. So now that you know that now that you know about the problem, what does it look like? How does it occur in everyday society? Mood is going to be one of the big factors in this. The person is going to be very irritable, very depressed sometimes. They're going to be very suspicious and withdrawn, and they talk excessively after breaks when they come back from being by themselves. An appearance, they can be inappropriately dressed. A lot of times you look for bloodshot eyes, poor hygiene, hand tremors, which are indicative of things like detox or DTs. And then excessive weight loss or gain can also be a big thing, one of the first things you notice in a person that's addicted to substances. Work performance. Anytime you alter your mind frame or anything like that, it's going to show in your work performance. You're going to be less productive. The quality of your work may be poor, which in nursing is not an acceptable thing. You don't want to have a poor nurse taking care of your family member. So this is, you need to keep an eye out for that. Inability to make decisions. They become very irrational when it comes to everyday decisions. Resist authority. They think that they feel that need to be in charge. They want to be in charge, and they can't concentrate as much. So that's another way to look at it. And then probably the most indicative category that we have is in relationships. They're going to have bad listening skills. They don't want to listen. They want to be the one to talk. Uncooperative, overconfident. They get to where they can't be told anything. They're always right. They're often argumentative and accusative of other things. And they discuss off-the-wall problems, and this is where the biggest, to me, the most, what's the word I'm looking for? The most, the thing that stands out the most in the relationship category would be the discussion of their problems. People come up to me and say, "Hey, I've had a bad day." Everybody has bad days, but when people repeatedly come up to you and they're like, "Well, my husband left me, or my wife left me, or my kids, acting a fool," that causes stress, and stress is the number one. Stress is the number one.
I wouldn't say indicator, but
Not indicator, but stress is the number one cause. Thank you, of substance abuse. And I've got a diagram here that shows the breakdown of several different industries or employments that had substance abuse problems. There's anything from social work to actual to sciences to education, and then you look at the healthcare category, and the healthcare professionals and technical skill people. They account for approximately 13% of this study. This was done in 2009, and 13% is a pretty significant margin for healthcare. And that's just the healthcare professionals, and not the sitters at home, and the pharmacy people. We're talking nurses, doctors, and PCTs here, and it accounts for a pretty significant majority of the population here. So really, in summary, what does this tell us? Number one, there's a problem with nurses that have substance abuse, and we have to identify the problems. It's just like all these nursing care plans they make us do. What's our problem? Our problem is substance abuse. Well, what's our assessment here? Well, that's easy access. A lot of people don't want to admit they have a problem, and once they do admit they have a problem, they don't want to seek treatment, or because of fear of getting fired or something like that. And so, what's our plan? You gotta have a plan. So we need to show them there's multiple different outpatient facilities. There's online counseling, telephone counseling you can do. A lot of them work either with your insurance. If it's not provided by your place of employment, it's going to work with your insurance to do that. Or they have some government-funded programs that you can get for relatively nothing. And then we want to know, well, how are we going to improve this? So early recognition is key. You want to help them find their treatment mechanism, and then even after treatment, you want to be there as a source of support. A lot of people come back if they're caught using substances on the job. They come back to work often because the State Board of Nursing knows that it's a problem. It's a disease just like cancer. So they need that source, that support system back at work, and that's what they're looking for. So I hope you learned something today. I hope that we didn't bore you for a whole 10 minutes long. And Chico says bye, just like everybody else. And hope y'all have a good day and good rest of the semester.